Hello, you are most welcome, ladies and gentlemen, to Real Impartation Moments on Tuesday Night Anatomy with Daniel Okwan. Now, today's section, I want to quickly run through some muscles that I've tagged Thoracoscapulohumeral muscles. Now, these muscles, most of them are going to be extrinsic muscles of the thorax. Now, you get to know that, yes, apart from the individual functions that these muscles are going to play, yes, most of them will have accessory function as far as, helping the various respiratory movement will be concerned. In inhalation and exhalation, they will serve as accessory muscles. So, without much ado, yes, let's quickly go through these muscles. Now, before I go through these muscles, they're very important that we know some kind of bony attachment. So there are two bones that I will spend some few minutes to actually go through them as far as, important prominences that muscles will attach, these important muscles. Now, if you take, this bone, yes, various views. There's the anterior view because you don't see the spine. Okay, you can see only the subscapular fossa. Yes, this is actually the lateral view because you can see where the glenoid cavity is. And of course, this is the posterior view because you can clearly see the spine eventually projecting, laterally to become the acromion. Now, what we find is that, yes, the scapula, which of course the layperson will call it the shoulder blade, is going to present with what we call a lateral border, of course, a medial border and a superior border. And we know the various transitions. If you are moving from a lateral border to the superior border, we are going to have this inferior angle. And then from, of course, the medial border to, of course, the superior border, we find what we call the superior angle. And then, of course, the superior border will dip, to give us this kind of notch, which we call the scapular notch. So we see various important attachment. Now, on the lateral border superiorly, we see this fossa, which we call the glenoid fossa. Now, on top of this glenoid fossa or glenoid cavity, we have a tubercle, which of course we will call it the supraglenoid tubercle. Supraglenoid tubercle. And then of course below it we are going to have another tubercle known as infraglenoid tubercle. Now, these glenoid tubercles are going to be important attachment point as far as actually origins for the long hairs of both, the triceps brachii and of course the long hairs of biceps brachii and the triceps brachii muscles respectively. So for instance, the supraglenoid tubercle will be the origin for the long head of the biceps brachii muscle. And then of course the infraglenoid tubercle will be the origin for the long head of the triceps brachii muscle. So these ones will be important origins that we have over there. Now, as you come down just below what we call the infraglenoid tubercle, we have what we call the origin. Okay, origin for what we call the teres minor muscle. The origin for teres minor muscle will be this area. Then as you go downwards below the origin of teres minor muscle, we are going to have origin for what we call the teres major muscle. Yes, both of them at what we call the lateral border of what we call the scapula. Now, at the inferior angle of the scapula, at the inferior angle, we have some fibers of what we call the latissimus dorsi actually originating from this area. Okay, and then if you go to what we call, another area where, let's go to the medial border. Now, if you get to the medial border is known for insertions. Yes, while most of the origins will be coming from lateral border, the medial border is for insertions. And insertions, what we mean is that, now let's look at this. Now, if you look at the medial border, we are going to present with two areas. An area where you see the spine, and therefore that's the dorsal aspect, or the posterior view of the scapula. Okay, so the dorsal aspect, that area, so that area which is related to the back aspect posteriorly, we are going to have three muscles inserting there. And these three muscles, we get to know that all of them will be supplied by, of course, the dorsal scapular nerve. You see those ones. So over here is with respect to the root of the spine of the scapula. Now, above the root of the spine of scapula, this area will be the insertion point for what we call the levator scapulae muscle. And then at the root of the spine will be the insertion for rhomboideus minor muscle. We see them. And then below the root of the spine up to what we call the level of the inferior angle of the scapula, we are going to have what we call rhomboideus major muscle. So these are important areas where we are going to see these muscles originating, of course, inserting. Now, apart from that, you see this one, which we call it the coracoid process. Now, coracoid process, from the superior angle where we have the scapular notch, then this process, which is having this kind of big shaped process or shaped like the beak of a crow. Okay, usually that's how we describe it. That's the coracoid process. Now 3 muscles are going to attach there. 2 of them are going to originate there, and 1 is going to insert there. Now these 2 muscles will be the short head of the biceps brachii muscle. Yes, apart from that, we have what we call the thoracobrachialis muscle, and then we also have an area where another muscle will insert. Okay, that will be, of course, the what we call the pectoralis minor muscle. Pectoralis minor muscle. So 3 muscles are going to attach there. 2 of them are going to originate, and then 1 of them going to insert. The one going to insert there will be, of course, the pectoralis minor muscle. Now at the superior notch, okay, there is 1 muscle which actually, yes, takes attachment here, and that's the inferior belly of what we call the humerus muscle, one of the strap muscles, okay, that we have in the head and neck region. Okay, so please visit the video that I've done. Under the triangles of the neck, you see, of course, what we call the humerus muscle. It's one of those strap muscles, superficial strap muscles. Okay, so that is what we are going to see. Now, I told you about the medial border of the scapula, that its dorsal aspect or its posterior aspect, 3 muscles are going to insert there. Now, at its ventral aspect, or at that side which is related to the ribs, and therefore we can also call it, the costal aspect, yes, this area will be providing, the insertion for what we call serratus anterior muscle. Serratus anterior muscle. So serratus anterior muscle, yes, will be the sole muscle which will insert on what we call the medial border of the scapula, actually on its ventral aspect. Okay, please bear in mind that if you talk about the medial border, we are still talking about the vertebral border, because that's that border which is related to, of course, the spine. Okay, so that's what we have. Now, apart from this, now we will see that there will be other areas. Yes, if you look at the acromion, the spine as well as acromion, okay, will be very important. Superior aspect of the acromion will be very important. Insertion point for what we call the trapezius muscle. Yes, of course, you see, of course, the middle and inferior fibers of the trapezius muscle. Yes, most of them will take attachment here. Now this area, yes, where the middle fibers of trapezius will be attaching, we call it, deltoid tubercle. Now this deltoid tubercle shouldn't be confused with deltoid tuberosity. Deltoid tuberosity will be insertion for what we call the deltoid muscle, which we see in the humerus, upper aspect of the shaft of the humerus laterally. This area will be the deltoid tubercle, middle fibers of trapezius will actually insert here. And of course, this whole area will be the insertion area for, the trapezius muscle. And then externally, we have this area for insertion by what we call some of the fibers of what we call origin. Now this area is for insertion for, the trapezius muscle, but this one will be for the origin of what we call the middle fibers of what we call the deltoid muscle. Origin for the middle fibers of the deltoid muscle. Okay, so that is what we are going to see. Now, another bone which we want to actually look at, yes, will be what we call the humerus. Now, the arm bone or the funny bone, yes, we know it's going to present with the head, but I'm interested in the proximal aspect. Now, the proximal just below the head and of course the anatomical neck, we are going to find 2 tubercles. Okay, so 2 tubercles will be found there. So one which is laterally placed and at a higher level, known as the greater tubercle, and then one which is, yes, a bit at lower level, yes, which we call it, the lesser tubercle, and it's actually anteriorly placed. Okay, now what we find is that, yes, on the greater tubercle there will be facets for 3 important muscles, and these facets you can remember with the mnemonic SIT, S-I-T. So S, okay, so these are the facets. S is for what we call the facet for what we call the supraspinatus muscle, okay, because supraspinatus muscle will be inserting there. And then of course the middle one is for what we call infraspinatus muscle, and then T for teres minor muscle. So that's the inferior facet. So there are 3 facets which we are going from superior to inferior, okay, on what we call the greater tubercle of the humerus. And these 6 muscles, yes, in addition to another facet which we find on the lesser tubercle for the subcapularis muscle, all these 3 muscles, okay, will be forming what we call, they will be the steering muscles, and that's what we call the rotator cuff muscles. Okay, so I've done muscles of what we call the actually done what you call the shoulder joint, where I made mention of these muscles. So you can visit that video for more, understanding of this area. So that is one thing. Now, one other thing too is that now you see that in between these two tubercles, greater tubercle and lesser tubercle, will be a groove. And this groove, yes, is therefore known as intertubercular groove or intertubercular sulcus. Now, this name is also having another, name. There's another name given to it, which we call the bicipital sulcus. Now, the reason why we are calling it bicipital sulcus is that, the tendon of the long head of the biceps brachii muscle, together with the tendon sheath, will run through this groove. So that is why we call this, groove also the bicipital groove or bicipital sulcus. Now, this bicipital sulcus, apart from admitting these ones, there will be important areas where, will be important attachment for muscles. And there are three muscles, okay, where you, with respect to, so it means that this groove will present with an outer lip or a lateral lip, because that's where you have the greater tubercle, and a medial lip where we have the lesser tubercle, and there will be a floor or an intermediate zone. So that floor will be for what we call the latissimus dorsi, actually coming to insert here, and then laterally will be the insertion point for what we call the pectoralis major muscle, and then the medial lip will be for insertion for pectoralis minor muscle. Now, please appreciate these areas, and because these insertion points will help you know the action that the muscle will actually going to perform upon its contraction. So what we are saying is that there's a simple mnemonic for you to know which muscles are inserted in which areas of this intertubercular sulcus, and it's simply by this mnemonic a lady between two majors. So we have a lady, the lady is in between them, and that's the latissimus dorsi. And then the majors from lateral to medial, laterally we are going to have what we call insertion point for pectoralis major muscle, and then of the medial one will be the insertion point for what we call teres major muscle. Okay, now one thing is that laterally on the proximal aspect of the shaft of the humerus, we see this triangular shaped roughened area, and that is what we call deltoid tuberosity. Deltoid tuberosity. Now this deltoid tuberosity, this deltoid tuberosity will be an important insertion point for what we call the deltoid muscle. Deltoid muscle. We will see the deltoid muscle. Now, opposite to it will be the insertion point. Okay, so we mean medially placed will be the insertion point for what we call the thoracobrachialis muscle. Okay, so that is a deltoid tuberosity. Deltoid tuberosity. All right, now there are other areas of interest. Okay, so I've done those videos where you look at muscles of the arm. You can visit that video, that of the forearm, what have you, to get those areas. But for now, for the purposes of what I'm going to do, I'm interested in all these areas, just these areas. Now, so that is what I've already showed you. All right, so the muscles, which I'm calling them the extrinsic muscles of the thorax, I begin with what we call the muscle which forms the bed of the breast, okay, and it's found in the pectoral region, and that muscle is what we call the pectoralis major muscle, the most superficial muscle there. Okay, that's the pectoralis major muscle, having its own fascia, pectoral fascia. Okay, so this is that muscle. Now, this muscle, is having two origins and therefore two heads. So it's going to have one head which will be originating from the medial aspect, medial half of what we call the clavicle. Okay, so there's the clavicle, this long bone, the only long bone which is horizontally placed in the body. So there's the clavicle, its medial half, okay, medial aspect, or its sternal, the one which is related to the sternum, okay, will provide that origin for its sternal fibers. Okay, so that's what we see. And then we also have what we call a sternocostal, origin or head. So its sternocostal origin, will be coming from what we call the upper six. Okay, so from rib 1 all the way to rib 6. Actually, they are costal cartilages, together with the body of the sternum. Okay, together with some portion of the mandible of the sternum. Okay, so all the way this way, that's what we're going to see. But what we see is that both the clavicular head as well as the sternocostal head will spiral together, and that's why we describe the fibers of what we call the pectoralis major muscle as having spiral type of fibers, and then eventually go and insert on what we call the lateral lip. Remember what we said, lateral lip of what we call the bicipital sulcus. Okay, lateral lip of the bicipital sulcus. Okay, so that is what we see here. Now this muscle, what will happen is that its clavicular head will be very important as far as the flexion, okay, of the arm at the shoulder joint is concerned. So this clavicular head will be important in flexion, okay, flexion of what we call the arm at the shoulder joint. Okay, now its sternocostal fibers, okay, will be important in extending the flexed arm. Okay, so if you've actually flexed your arm, okay, at the shoulder joint with the help of what we call the medial fibers, or what we call the clavicular head of what we call the pectoralis major muscle, then you can bring that flexed arm to or you can bring it back to its normal position, and that's why we say that you are going to help what we call extend the flexed arm at the shoulder joint. So it means that yes, if they are working solitary individually, then the sternal head, the sternocostal head, and then the clavicular head will be antagonists, so to speak, such that the sternal head will be important in flexing the arm at the shoulder joint, and then the sternocostal one will be important in bringing or in extending the flexed arm, okay, back to its normal place. Okay, and that's very important aspects that we have to know. But one thing is that if they are working together, yes, they will be very important. Now one thing is that if we are flexing the arm, then it will also be important as far as medial rotation, yes, will be concerned. Okay, so if you are flexing it, then you are also helping in that kind of medial rotation. So essentially, yes, the pectoralis major muscle will also help in medial rotation, yes, of the arm. Okay, so that's one important thing. Now another thing too that we find is that we say that it is one of the accessory muscles as far as climbing is concerned. It's not the main muscle. Now you know that muscles as far as climbing is concerned, yes, the leg muscles or the lower limb muscles will be very important. But importantly, as far as the trunk is concerned, then the important muscle which will be very important, yes, regarding what we call climbing, will be what we call the latissimus dorsi. But augmenting the function of this latissimus dorsi as far as climbing is concerned, yes, will be by what we call the pectoralis major muscle. I already told you, I don't need to tell you again, that these muscles will be important accessory muscles of what we call the the thorax as far as the respiratory movement is concerned. Now the next muscle which we are going to look at is what we call the deltoid muscle. Now this deltoid muscle, yes, in most cases of intramuscular injections, yes, in the arm, yes, that's where it is given. Okay, so this is a very important muscle. That's the deltoid muscle. Now this deltoid muscle, yes, I've told you that, yes, now you can see that it's roughly triangular shaped. Yes, it's going to originate this time around from the lateral third. Now remember that we saw that pectoralis major muscle, one of its hairs being the clavicular head, originated from the medial half, okay, of what we call the clavicle. Now this time around from a lateral half, lateral third of the clavicle will take origin, yes, by it will take origin from this area. That's the deltoid muscle. Yes, even apart from that, yes, I told you where we have, of course, the acromion, okay, together with some portion of the spine of the scapula, but mainly the acromion process. Then eventually, yes, all these fibers will come together to insert on that triangular, roughened area on the proximal shaft of the lateral aspect of the humerus, and that is what we call the, deltoid tuberosity. Now, remember, I didn't tell you now, for the pectoralis major muscle, yes, that one will be supplied by what we call the medial and lateral pectoral nerves. Okay, so that's what you want to see. Now the pectoralis major muscle will be supplied by one of the terminal branches of the posterior cord of the brachial plexus, and that is what we call the axillary nerve. Yes, with root value C5 and C6. Yes, that's the axillary nerve. Okay, now so these fibers, now we can actually divide, yes, the pectoral muscle into three fibers. Okay, so we have that fibers which will be coming from the clavicle, okay, lateral third of the clavicle, forming actually the anterior fibers. Then we have the medial fibers, okay, coming from where we have we have the spine, and then we're going to have what we call the lateral fibers where we have the acromion. Okay, so we have all these ones, and then eventually converge to insert on the deltoid tuberosity. So what we say is that these fibers will have different functions. So for instance, you can see that the anterior fibers is more medial. Okay, so the anterior fibers will be important as far as medial rotation of the humerus at the shoulder joint is concerned. Then if I perform medial rotation, then essentially flexion, yes, so flexion and medial rotation, yeah, they tend to move hand in hand. Okay, so flexion and of course medial rotation over here. Then apart from that, yes, we also have the middle fibers. Now the middle fibers will be very important in helping produce what we call 15 to 90 degrees abduction at the shoulder joint. So taking the shoulder joint or the upper limb, yes, away from midline of the body, yes, at the shoulder joint, and that will be by what you call the middle fibers of the deltoid muscle. Now remember, you see another muscle which you call the supraspinatus muscle. Okay, supraspinatus muscle is the initiator of what we call the abduction at what we call the shoulder joint. So for you to continue propagation of that abduction up to 90 degrees will be by what we call the middle fibers of the deltoid muscle. Then we have the posterior fibers. Now for posterior fibers, you can see it's more posteriorly placed. So posterior fibers will be important as far as lateral rotation. So while this one was doing medial rotation, anterior fibers, yes, posterior fibers will be doing lateral rotation. Now if you are doing lateral rotation, then essentially you are going posteriorly, and therefore you say you are doing what we call extension. So extension at what we call the shoulder joint. Okay, so that's the deltoid muscle for you. Now the other muscle which will be very important, yes, as far as producing more than 90 degrees abduction at the shoulder joint through that kind of scapulahumeral rhythm, and that is what we call the trapezius muscle. Now this trapezius muscle is actually triangular shaped, but if you combine, yes, they are contralateral, so one on either side. If you combine both of them, then you get that kind of trapezoid shaped muscle, but it's actually triangular shaped. Okay, so it's going to originate from what we call the medial third of what we call the superior nuchal line. So on the skull, if you visit the video that I've done on the skull, you see what we call the superior nuchal line. It's medial third of it actually, as well as of course the external occipital protuberance or the inion. Then of course through ligamentum nuchae. Okay, ligamentum nuchae will be be superior to the spinal spirates of most of the cervical vertebrae. But at the end of the day, yes, the 7 cervical vertebrae will take origin from that area, as well as all the thoracic vertebrae, the spinal processes of all thoracic vertebrae. Okay, so that's what we're going to see. So it's going to have a vast originating from a medial third of what we call the superior nuchal line, yes, of course, as well as the inion. Okay, then together with of course the ligamentum nuchae, okay, or nuchal ligament. Then of course the 7th spinal process of the C7 vertebra. Then of course all the spinal spirates of the thoracic vertebrae. Then at the end of the day, you can see how the fibers are moving. They are moving in this manner so that they can insert on what we call the spine of the the scapula, as well as of course the acromion of the scapula. Okay, so these are some areas that is going to insert, but at the end of the day, it also insert on what we call the lateral third of what we call the clavicle, lateral third of the clavicle. So these are some areas that these are important insertion points of what we call the trapezius muscle. So that's the trapezius muscle. Therefore the trapezius muscle, we can consider that it's going to have upper fibers, it's going to have middle fibers, and then of course it's also going to have what we call lower fibers. But at the end of the day, they are all moving to actually find insertion on what we call the superior aspect of what we call the spine of the scapula, yes, the acromion, as well as of course the lateral third of what we call the clavicle, lateral third of the clavicle. So these are the insertion points. Now therefore it tells us that yes, they are form of action will be slightly different. I've told you that for overhead abduction, that's more than 90 degrees abduction, okay, raising it above. Yes, I've told you that initiation of abduction will be that by what we call the supraspinatus muscle, 0 to 15 degrees abduction. Then 15 degrees to 90 degrees abduction will be by the middle fibers of the deltoid. Now overhead abduction, now going beyond 90 degrees, will be by what we call the trapezius muscle. Apart from that, there will be another muscle, Serratus anterior muscle. You see that one, okay, also helping in that regard. So what will happen is that yes, the upper fibers will be very important as far as flexing of the neck is concerned. You can see that it's more closer to the neck area, so it's going to be helpful in flexion of the neck. Then of course the middle fibers will be very important as far as retraction of the scapula is concerned. So they help in retraction of the scapula, okay, is concerned. Then the lower fibers will help in depressing of what we call the shoulder. So what we see is that upper fibers, yes, will help in flexion of the the neck, and then inferior fibers will help depress the the what we call the shoulder. But one thing too is that apart from helping flex the neck, the upper fibers also help elevate. So it means that the upper fibers and lower fibers are antagonistic, while the upper fibers helping in flexion as well as helping elevate the shoulder. Then what happens is the lower fibers will help depress it, and then the middle fibers will help retract the shoulder. So that is what we are actually going to see. But one key thing is that all these muscles will help in the extension of the neck. So in the extension of the neck, yes, all of them will work in unison to help extend the neck. But remember, very importantly, yes, overhead abduction, more than 90 degrees abduction, will be done by what we call the pectoralis, the trapezius muscle, as well as, of course, the latissimus dorsi. We see that. But one key thing over here is that now this muscle, which is the what we call the trapezius muscle, will be very important, yes, posterior boundary of what we call the posterior triangle of the neck. So in the posterior triangle of the neck, there's one nerve which will be related to it. We will see that nerve. Now that nerve is called the spinal accessory nerve. That's the cranial nerve 11. Spinal accessory nerve will give motor supply to what we call the pectoralis, trapezius muscle. Now you see that in most cases that you get to see that there will be another muscle which will also be supplied by what you call the spinal accessory nerve. You see that one, and that one will be the Tenoclidomastoid muscle. You see that one, but its proprioceptive, as far as innervation through proprioception is concerned, will be coming from C3 and C4, cervical nerve levels. So the next muscle which I want to show you. Now I told you that on the dorsal aspect of the medial border of the scapula, 3 muscles are going to insert there. Yes, one of these muscles which insert above the root of the spine is going to be what we call the levator scapulae muscle. So levator scapulae muscle, yes, will actually originate from the transverse processes of what we call C1 to C4, okay, vertebral levels, transverse processes of C1 to C4 vertebral levels, and of course will come and insert on the dorsal aspect of the medial border of the scapula above the root of the spine, okay, this area. Now I already told you that all these nerves which will be inserting along the dorsal aspect of the medial border of the scapula will be innervated by what we call the dorsal scapular nerve, yes, with root values. Actually, dorsal scapular nerve, yes, will actually have root value of C5, actually C5. Now these ones, please don't take these ones, C5 root value, okay, C5 root value. But there could be other nerve supply, okay, from the cervical plexus, but mainly as far as the brachial plexus is concerned, dorsal scapular nerve, yes, root value is actually C5. Okay, so by way of action, yes, it will help. Yeah, the name tells you what it is going to do. Levator scapulae. It will help, raise or elevate this, medial border of the scapula. Okay, but one thing too that we find is that it forms part of what we call the floor of what we call the posterior triangle of the neck. Now, usually in the posterior triangle of the neck, you may not see it, instantly, because it will be covered by what we call the prevertebral, fascia of what we call, the deep cervical fascia. I will take you through one of these days, the fascia, the deep fascia of the neck, so that you can actually appreciate these ones. It actually, covers these ones. So sometimes you don't see unless you take away that kind of fascia out of it. Now the next muscle, which there are 2 muscles, both of them also inserting the mid-dorsal aspect of the medial border of the scapula, and that is what we call the rhomboideus major and rhomboideus minor muscles. Now, if it is rhomboideus minor muscle, then it's going to originate from the nuchal ligament. Okay, so ligamentum nicae that I told you about, the nuchal ligament, it will be taking origin from that area. Yes, apart from that, the spinous process of C7. So remember that beyond C7, the nuchal is not there. So with C7, it will take that kind of spinous, attachment from it, the spinous process, as well as T1, and then it will go all the way to insert at the root of the spine of the scapula. Then we have the other one. So beyond, so from what we call the C7 to T1, then beyond T1, so we go to T2 all the way to T5 spinous processes. Then we are going to have the origin from what we call rhomboideus major muscle, so that then it goes and inserts onto what we call the dorsal aspect of the medial border of the scapula below the root of the spine of the scapula. So these muscles are the what we call the rhomboideus muscles. And what importantly, one thing is that these muscles are going to help in retraction of the scapula. So retraction of the scapula will be done. So it tells you, now look at where it is inserting. So it's going to help in that retraction of the scapula. So I told you that for you to know the action of the muscle, just know its insertion, very important. So this muscle will be very important in retraction of the scapula. Now apart from that, it's also going to help in rotation. Okay, so rotate it to depress the glenoid cavity. Okay, so it's also going to help in fixing the scapula to the thoracic wall. So these are some functions that, of course, the rhomboideus muscles are going to perform. Yes, I don't need to tell you. The innervation is coming from dorsal scapular nerve, of the brachial plexus. Okay, coming from the the upper, the roots of the brachial plexus, actually coming from C5 roots. Okay, so that's that nerve. Now, the next muscle that we're going to look at is what we call the serratus anterior muscle. Now, I already told you that the serratus anterior muscle, working in synergy with what we call the trapezius muscle, will be very important in the overhead abduction, okay, of the arm at the shoulder joint. So it's going to originate actually from what we call the external surfaces of these ribs. Usually 1 to 8, but sometimes even the 9th one could provide that kind of origin to it, so that its origin gives it a saw-shaped appearance, saw-tooth shaped appearance, and because of that, that's why I call it serratus. Okay, and because this muscle is taking origin from the anterior aspect, you can see it over here, and that is why we call it serratus anterior muscle. Very soon we see the serratus posterior muscles as well. So it goes all the way. Then I told you this is the scapula, this is the medial border of the scapula, but ventral aspect of the medial border of the scapula will provide our insertion point for what we call serratus anterior muscle. So this muscle, I don't need to tell you that is going to be very important in overhead abduction at the shoulder joint, more than 90 degrees abduction at the shoulder joint. It also helps to rotate the scapula, upwards. By so doing, in helping in overhead abduction, you need to actually rotate, this kind of scapula. Okay, so that's why it's going to do that. Then it's also going to elevate the ribs when the scapula is fixed. Now look at it. We said that usually the action is at where there's that kind of insertion. But if what we call the medial border of the scapula is fixed, okay, if the or is stabilized, then what will happen is that it can help elevate these ribs, and therefore very important accessory muscle as far as the respiratory movements are concerned. Now, one key thing that you have to know is that this muscle is also known as the boxer's muscle. Or we call it the big swing muscle, or the boxer's muscle. Because it's going to help in actual what we call protraction. This time not retraction, but rather protraction. Okay, so this way, protraction of the scapula when one throws a punch. Okay, so protraction of the scapula when one throws a punch. That is why we call this muscle what we call the boxer's muscle, or the big swing muscle. Okay, so that's one important thing that we have to know. Now, importantly, this muscle is actually supplied by the long thoracic nerve. Actually with root value C5, C6, and of course C7 root values. Okay, that's the long thoracic nerve, and that's why if there's an injury to this long thoracic nerve, then it will lead to what we call winging of the scapula, which is evident by that kind of prominence that we see at the medial border, as well as of course the inferior angle of the scapula. Now, if you've seen serratus anterior muscle, then we also have to see serratus posterior muscles. Now, for serratus posterior muscles, they are different from the serratus anterior muscle. For these reasons. Now, for serratus anterior muscle, we have a single muscle. Okay, the fibers are just moving in a particular fashion to insert at a particular area. So you have a single muscle. But for serratus posterior muscle, we have divided into two groups. We have serratus posterior superior, and then we have serratus posterior inferior muscles. yes, one other thing too is that they have no insertion, or they have nothing to do with the scapula, unlike serratus anterior muscle, which are inserted at the ventral aspect of the medial border of the scapula. This is not the case for what we call the serratus posterior muscles. Okay, so that's one key thing. Now another key thing is that, yes, unlike serratus anterior muscle, which originated from where we have the ribs, now these ones, yes, will actually be inserting over here to the ribs, but their origins will be coming from what we call the spine of these vertebrae. So these are some reasons that we are going to see regarding these serratus posterior inferior muscles and superior muscles. Now the reason why we are calling them serratus is that they present with this same saw-shaped appearance, sawtooth-shaped appearance. Okay, so if you talk about serratus, yes, posterior superior, then that one will be coming from what we call the spinous processes, as well as the supraspinatus ligaments, okay, of C7 to actually T12. Okay, sorry, T2 actually. So from C7, spinous processes of C7, as well as the associated ligaments, which we call them supraspinous ligaments, all the way to T2, thoracic vertebral level. Okay, so they actually, 1, 2, 3, 4 fibers, okay, slips. That's what we are going to see. But one thing is that they are going to insert, on ribs, actually 2 external surfaces of the posterior aspect of these ribs, which are ribs 2 all the way to rib 5. Okay, so that's how they are going to insert rib 2 to 5. Okay, so that's what you are going to do. Now I've told you that these muscles are going to be very important as far as respiratory movement are concerned. This one is going to look at where it is set. So it means it can help elevate these ribs. Okay, it can help elevate ribs 2 to 5, and therefore will be very important in forced inspiration, because in inspiration we want actually the ribs to get elevated so that the intrathoracic volume will actually increase, reducing intrathoracic pressure. So that is what we are going to see. Okay, then based on where it's actually inserted, yes, it tells you where we are going to have it. What we call nerve innervation from what we call the ventral rami of T2 to actually T5 levels. Now the other muscle, okay, so look at how this one, it originated this way, but the fibers came infero laterally. So the fibers of serratus posterior inferior, they run inferolaterally. But look at the fibers of serratus posterior inferior, they run superolaterally. Okay, so that's how the fibers run, because they also be originating from what we call the spinous process, as well as the supraspinous ligaments of what we call T11 all the way to L2, T11 all the way to L2, and they also move superolaterally to actually insert on what we call ribs 9 to 12. Therefore, yes, it will be supplied by the ventral rami of spinal nerve levels T9 to L2 actually. So that is what we are going to see over here. So that is that. But one thing that you will see is that this one, unlike the serratus posterior superior, which help in forced inspiration, this one will help in forced exhalation, because look at how the fibers are running. They run this way. Look at where they insert. Therefore, they can help depress these ribs. So once these ribs get depressed, then what will happen is that, yes, it tends to reduce intrathoracic volume, and therefore increase intrathoracic pressure to help in forced expiration. So that's the serratus posterior muscles. Now the other muscle. Now I told you that the muscle, which was the superficial muscle in the pectoral region, okay, which was forming the bed of what we call the breast, was pectoralis major muscle. If I cut the pectoralis major muscle and reflect it, then a deep muscle that I'm going to find having these 3 slips are going to be what we call the fibers of the pectoralis minor muscle. Now this is pectoralis minor muscle. So pectoralis minor muscle actually originates from what we call the external surfaces of ribs 3 all the way to rib 5 levels. Okay, and that's actually near their what we call costal cartilages. All right, now the fibers move superolaterally to actually insert. I told you that's where they are going to insert on the coracoid process of the scapula. Then we said that pectoralis major muscle was innervated by what we call medial and lateral pectoral nerves, yes, this time around for pectoralis minor muscle, it will be innervated by only the medial pectoral nerve. So this muscle will be important as far as depression and protraction of the scapula is concerned. So depression and protraction of the scapula, yes, will be done by the pectoralis minor muscle, because I told that's where it inserts. Okay, so we can help depress the scapula, okay, bring it down, and then again it will also help in that kind of protraction, okay, protraction of the scapula. Now apart from that, if the insertion is fixed, okay, because I told you that usually if you want to look at the action of the muscle, look at its insertion point. If the insertion is fixed, then it will help in elevation of these ribs, and therefore during forced respiration inspiration, they will be very relevant to help increase intrathoracic pressure. Then it will also help rotate the scapula downwards. It will also help rotate the scapula downwards, okay, and it will do that, you know, alongside the rhomboideus muscle that we've seen. Now another muscle which, you know, if I cut and reflect the same pectoralis major muscle, I will see, and that muscle, yes, it's a very small muscle which is under the clavicle, and that's what you call the subclavius muscle. So this subclavius muscle will actually originate from the upper surface of the first costal cartilage. But actually, yes, if you want to actually see it, it will be at where we have the first costochondral joint. That area, that's where the muscle is originating. And then it moves upwards to insert on the inferior aspect of the middle third of the clavicle. So there's the first medial third, this is the intermediate third, and there's a lateral third. So the intermediate third of what we call the clavicle provides that insertion point for what we call the subclavius muscle. So I don't need to tell you, the subclavius muscle will be, yes, innervated by nerve to subclavius, okay, coming from the upper trunk of the brachial plexus. Therefore it means C5 and C6 root values. So this muscle, based on where it is inserting, then it tells you that it's going to help depress, okay, that's where it's inserting, so it's going to help depress what we call the clavicle, okay, and then it also steadies the clavicle during movement of the shoulder girdle. If I talk about the shoulder girdle, I don't need to tell you, talking about the scapula and of course the clavicle. Now, the next muscle which we want to look at are the scalenus group of muscles. Now, the scalenus group of muscles, yes, we have scalenus anterior muscle, scalenus medius, and of course scalenus posterior muscle, or anterior scalene, middle scalene, and posterior scalene muscles. Now, these muscles, yes, the middle scalene muscle is actually the largest, okay? It's actually the largest. The least one or the smallest one, and the deeply placed one actually being the scalenus posterior muscle. So you see that. Now, what we find is that now this first muscle that we're going to look at is the scalenus anterior muscle. Now, this scalenus anterior muscle, the unique thing about it is that, yes, it's very important whenever you want to describe, you know, the relations or the various part of the the subclavian, you know, artery, so that we can use the scalenus anterior muscle to describe, okay, because the subclavian artery actually runs behind it, so that we can describe the subclavian artery into, you know, the medial part, the posterior part, or the deep part, and of course the lateral part. So this muscle is actually very important. Now, apart from that, yes, this muscle also creates that kind of tubercle on what we call the first rib. So it's also a very important muscle. Now, one unique thing about this muscle too is its origin. It originates from only the transverse processes of what we call the typical ribs. So the typical ribs are what we call typical cervical vertebrae are what we call C3 to C6. You know, C1, C2, and of course, you know, the C7 are atypical. You know, C1 is the atlas, C2 is the axis, and C7 is the vertebral prominence. So we're taking origin from the typical vertebrae. Typical cervical vertebrae will be the scalenus anterior muscle, and then comes and inserts on what we call the scalene tubercle. And last time we said that the scalene tubercle will be somewhere between, of course, where we are going to have the grooves of subclavian artery and the groove for subclavian vein, and of course the groove for subclavian artery. Okay, so that is what we see. Now, this one, yes, by way of action, you can see that's where it's inserting. So it's going to help elevate. Okay, so it will help elevate the first rib, And remember, one thing about these scalene muscles will be that they will all help in what we call lateral flexion of the neck. Lateral flexion of the neck. So that's the scalenus anterior muscle, with innervation coming from, of course, the ventral rami of the various spinal nerve levels. Okay, that we see. Now, the next muscle, which is also a scalene muscle, will be the scalenus medius muscle. Now, the surprising thing is that scalenus medius muscle is also inserting on the first rib. Okay, it's inserted on the first rib, upper surface of the first rib. Although that one, we don't see that kind of tubercle on the first rib. But this time around, the medius, takes a superior, what we call atypical rib, and it takes another inferior atypical rib, in addition to the typical ribs that, of course, usually the scalenus anterior muscle will take origin from. And therefore, we say that the origin of the scalenus medius muscle will be coming from the transverse processes of what we call C2 all the way to C7. Also comes all the way to insert on the superior aspect of what we call the first rib. Yes, I don't need to tell you, it also assists in what we call elevation of the first rib, as well as helping in lateral flexion of the neck. And then, of course, they'll be supplied by, of course, the various segment levels of the ventral rami of the cervical nerves. Now, the other muscle, which is, I told you, are the smallest and that's the deepest actually, is what we call the scalenus the posterior scalene muscle, posterior scalene muscle, or scalenus posterior muscle. Okay, so that one, that one actually originates, it's just very small, and therefore originate from what we call C5 all the way to C7 transverse processes, and of course comes and inserts on rib number 2, superior aspect of rib number 2. So it tells you that by way of action it will help elevate rib 2. Okay, so these are then, apart from that, helping in, of course, lateral flexion of the neck. I told you that all these scalenus muscles will help in lateral flexion of the neck. Now, another muscle which I want to look at is what we call the Tenoclidomastoid muscle. Now, I told you that when we looked at what we call the trapezius muscle, okay, and that's the trapezius muscle, I told you that its medial border actually forms the posterior border of the posterior triangle of the neck. Okay, I told you that its motor supply will be coming from the spinal accessory nerve. Another muscle whose motor supply will be coming from spinal accessory nerve, okay, in the neck region, is actually what we call sternocleidomastoid. This muscle I'm going to talk about. So this muscle is actually going to have two origins and therefore two heads. It's going to have what we call a clavicular head, okay, coming from the medial third of the clavicle. This is the clavicle, okay, and then it's also going to have what you call the sternal head, which will be coming from, of course, the manubrum of the sternum, okay. But both heads, will form a single belly to insert, importantly, in what we call the mastoid process of the temporal bone. Mastoid process of the temporal bone. So it means that this muscle will be very important. Okay, one important thing is that, of course, if now we have contralateral aspect, one on this side and one on the other side. Now this muscle will help divide this so-called quadrangular shaped neck, okay, if we take a lateral view of the neck, then into what we call two triangles. So behind this muscle will be the posterior triangle, and in front of this muscle we have what we call the anterior triangle. So this muscle is very important in doing that. Now, by way of function, if just one muscle, okay, now we have one here, we have another one, so they are contralateral structures. So if this muscle contracts, okay, just a single muscle, or if they contract individual contraction of these muscles will help in what we call rotating the head to the opposite side. Okay, so if this muscle, which is related to the right side, if you contract, then it rotates the head to what we call the left side, or the so-called contralateral side. Okay, but one thing is that if both of them work in unison, then what will happen is that they depress the neck or they flex the neck. Okay, so they help in what we call flexing of what we call the neck. Okay, so that is what you have to know about what we call the sternocleidomastoid muscle. Now this sternocleidomastoid, just like the trapezius muscle, its motor supply is coming from the spinal accessory nerve. So the spinal accessory nerve runs in the posterior triangle of the neck, and that is why if there is an injury to this spinal accessory nerve in the posterior triangle of the neck, it will lead to a condition that we call torticollis, or the right neck. Okay, it will lead to right neck. Okay, so in most cases there's that kind of abnormality that we find. So it will lead to what we call wry neck. Okay, so that is one thing that you have to know. There wouldn't be problem with trapezius muscle if the injury occurs actually in what we call the posterior triangle of the neck, because what will happen is that the trapezius would have been supplied already. Okay, that's an important bit that you have to know. Now, these muscles, yes, we call them what we call strap muscles. They are the infrahyoid muscles. Now, these muscles, I've done a video on the triangles of the neck. So please, if you get that video, please visit that video that I've done on the triangles of the neck to actually get more insight in these ones. Now, one of those muscles, those superficial muscles, is what we call a stenohyoid muscle. Now, even omohyoid. Now, this is omohyoid muscle. We've seen the omohyoid, that's its inferior belly. This is the superior belly of omohyoid muscle. Now, this muscle, which is the superficial muscle of the infrahyoid muscle, or the strap muscle, is the stenohyoid. So the name tells you where it's originating from sternum, okay, all the way to the hyoid bone. Okay, so sternum, medial aspect or internal aspect of the mandible or the sternum, okay, as well as even the medial aspect of what we call the clavicle. Okay, so it will take origin from this area as well, and then it goes all the way to insert on the medial aspect of the body of what we call the hyoid bone, inferior aspect of the body of the hyoid bone. So this is what we call the stenohyoid muscle. Okay, it will help actually depress what we call the hyoid bone. It's an infrahyoid muscle. Now, even apart from that, if I cut and reflect these muscles, you can see other muscles like the stenothyroid, based on attachment. Okay, this is a thyroid as the body of mandible of the sternum, so stenohyoid. Then even we can have this muscle being what we call thyrohyoid muscle. This muscle over here, the actual deep muscle. So these are the strap muscles. Please visit that video so that you get more insight. Remember, most of these muscles are supplied by what we call ansa cervicalis, okay, of what we call the cervical plexus. Ansa cervicalis, actually C1, C2, C3 root values. Now, the next muscle that I want to show you will be what we call the teres major muscle. Teres major muscle. Now, for teres major muscle, it's actually going to originate, okay, from what we call the lateral border of the scapula. Lateral border of the scapula is going to provide that kind of origin for it. I've told you that, yes, if you go below the teres minor muscle, its origin, yes, lateral border of the scapula will provide that kind of origin for what we call the teres major muscle. Then, it goes what we call superlaterally to actually insert on what we call the medial lip of what we call the intertubercular sulcus, medial lip of intertubercular sulcus. That's what we said, a lady between two majors. Now, this muscle, yes, will be supplied by what we call the lower subscapular nerve. Okay, lower subscapular nerve will be supplying this muscle, teres major muscle. Now, this muscle, by way of action, will help in what we call medial rotation of the humerus, because it's going to insert on the medial lip of the intertubercular sulcus. So it's going to help in medial rotation of what we call the scapula. It also assists in what we call adduction, okay, bringing the upper limb towards the midline of the body. It also assists in adduction, okay. Then apart from that, it also, because it's going to help in what we call medial rotation, it's also very important in extension. It's also assists in some extension, okay. So mainly the key thing is that because it's going to insert on lateral lip of what we call intertubercular sulcus, it will be very important in what we call medial rotation, okay, of the humerus. Now, the next muscle, if you've seen teres major, then it means you can see teres minor. Now, for teres minor, yes, you're going to originate from the inferior, okay, lateral aspect of the scapula. I told you that this is the lateral border. So just below where we have what you call origin for what we call the long head of the triceps brachii muscle will be the origin for what we call the teres minor muscle. At the end of the day, I told you that it's going to insert on the inferior most, articular facet on the greater tubercle of the humerus. And you remember with the help of the mnemonic set. So SIT, okay, T for teres minor. Okay, so that is what we are going to see. And this one, because it's going to insert on a greater tubercle, and its greater tubercle is more laterally placed, teres minor will be antagonist to teres major muscle, and therefore will help in what we call lateral rotation. Lateral rotation. Also assisting in some adduction anyway, as well as extension, okay, of the arm at the shoulder joints. But the key thing over here is that this nerve will be supplied, this muscle will be supplied by what we call axillary nerve. Okay, axillary nerve will supply this one. Axillary nerve, yes, apart from supplying the apart from supplying what we call the deltoid muscle, we also supply what we call the teres minor muscle. Now there are other muscles which we want to actually see. Yeah, this muscle based on, now we have what we call supraspinous fossa, taking origin from supraspinous fossa will be what we call supraspinatus muscle, and then taking origin from infraspinous fossa will be the origin for infraspinatus muscle. And then of course, teres minor will also come in that way to go and set it. So there will be that areas. So I told you about the sit, SIT, on the tubercle of what we call the humerus. So just by way of looking at so that's the supraspinatus, okay, going to insert on the superior facet on the greater tubercle after originating from the supraspinous fossa. Infraspinatus from what we call the infraspinous fossa also inserting on the middle facet on the what we call the greater tubercle of the humerus. So these are those two muscles. Now one key thing is that the supraspinatus muscle will be very important in initiation of abduction. I told you about that one. 0 to 15 degrees abduction will be carried out by the supraspinatus muscle. But one key thing is that infraspinatus, okay, is inserting on the greater tubercle where it's laterally placed, will help in lateral rotation of the humerus. So that is one key thing that we have to know. Okay, but remember, the nerve supply, okay, will be coming from suprascapular nerve. Yes, both supraspinatus and of course infraspinatus will be innervated by what we call suprascapular nerve. Now, the next muscle, which usually we call it the forgotten tendon, or whose tendon is called forgotten tendon, is the subcapularis muscle. Now, this is subcapularis muscle, okay, taking origin from the subscapular fossa, and then of course inserting on the articular facet, which you find on the lesser tubercle of what we call the humerus. Okay, this one will be innervated by the upper and lower subscapular nerves. Yes, upper and lower subscapular nerves actually. And this nerve, this muscle, we describe it as being multipinnate. Okay, so you're having a multipinnate, that kind of appearance. Now, because it's inserting on what we call the lesser tubercle, which is anteriorly placed, and therefore more medial than what we call the greater tubercle, then it means this, muscle will be important in medial rotation of the arm at the shoulder joint. Okay, and it's also very important in stabilizing the shoulder joint because one of the rotator cuff muscles, apart from these sit muscles, supraspinatus, infraspinatus, teres minor, subscapularis muscle, performing their individual function, they'll be very important in providing some kind of partial stability to the shoulder joint. Now, there's one muscle which is a back muscle anyway, but it's very important in providing that kind of accessory function to what we call the respiratory system or the thoracic cage, and that muscle is the Levitorius costarum. Okay, so there are some kind of these muscles over here which we call them Levitorius costarum. Now these muscles, now you can see this is the back, so it means that in the paravertebral gutter, that's where we are going to see them. Okay, they will actually originate from the transverse processes of C7, okay, 7 cervical vertebrae all the way to T11, and what they are going to do is that immediately they originate, then the fibers will insert on the rib just below it, okay, just below it, and that's how they are going to insert. And by the name Levator costarum, okay, they will be very important in helping in what we call elevation of what we call the rib cage, elevation of the ribs actually. So that's one important thing. And of course they will be supplied by what we call the dorsal rami of what we call T1 to T12. Yes, very long, that kind of nerve supply, okay, dorsal rami of T1 to T11, although it is originating from C7 all the way to T11, and then immediately after originating, then it's inserted on a rib just below it, and that is what we call the Levator costarum muscle. This has been a very long journey trying to look at these muscles, which some of them are accessory muscles to the respiratory movement. These muscles, yes, most of them being extrinsic muscles of the thorax, I hope you find this helpful. Please try and appreciate these ones. And very soon we actually go into the clinical application of all these muscles to actually understand, yes, if something goes wrong, what are we going to see? I hope you find it helpful, and may you have a good night.